and a warm welcome to Good Morning Sri Lanka. My name is Banu Vikramasinghe, your host as usual on a beautiful Friday morning. Well, it's TGIF, it's 20th December 2013. Well, 1 year ago today we were worried that the world was going to end on the 21st December 2012, but we're safe and sound watching the best morning show here on MTV Sports on Good Morning Sri Lanka. Well, I'm pumped up today because I've got a very, very interesting guest, just as usual on our show, and he's been a continuous and a repeated customer for us, and because of a certain element of his personality, well, because he's genius, anybody does, and we're going to talk about something very, very important and current, just as usual once again, though we will be touching on certain elements that we haven't touched in GMSL so far. Welcome to Good Morning Sri Lanka once again, sir.
Good morning.
Well, it's been a privilege to have you once again. How does it feel?
I really love coming on the show and speaking about sports and sports injuries. And
yeah. Well, Dr. Harindu Vijayasinghe, he does not need a further clarification. He's been here twice so far, and this is the lucky third time, yeah? Yes. Alright, to get down with business, I'm going to ask you, what's a sports injury and what types of sports injuries are there, and how is it relevant to especially the youth out there?
Yeah, when we speak about sports, actually we speak about two things, sports and exercise.
Yeah.
And now, rather than calling it sports medicine, we like to call it sports and exercise medicine. Because sports means that you have a competitive element and you're playing against somebody, but most of the injuries that we see are not only sports. People doing day-to-day exercise, they also get injuries. So when we speak about these injuries with sports and exercise, there are several types. We like to divide it basically into, one is the acute type, which occurs suddenly due to some element, and the chronic type, which comes over some time by repeatedly doing something, overdoing something, or repeatedly doing something wrong.
Okay.
So those are the two very broad categories of a sports injury, acute and chronic injuries.
Okay, so if you want to subdivide the acute, are there further clarifications if you want to concentrate on that firstly?
Yes, when we look at the acute, we start with the most basic acute injury, which is a contusion or a bruise.
Okay, what is that?
Yeah, you have a small bang somewhere and you get some blood collecting under your skin, and you get a nice bump there, right? So you can get it. So it's one of the basic
So the reason why there's a bump, fellows, is because of the bruise that you have. Blood clots, is it?
Because the skin is very vascular. There's a lot of blood supply there. And you get a trauma, blunt trauma there, you're going to collect some blood underneath the skin. And that's what we call a bruise or contusion.
Alright. Continuing from that onwards.
Next would be injuries to our ligaments. We call them sprains, and injuries to muscles, we call them strains. So sprains and strains in layman terms, and this is another very common injury. We know when we take our body, all our joints are supported by a lot of muscles and their tendons. The difference between a tendon is when the muscle comes, it inserts as a tendon, right? And a ligament it just bridges the bones, right? Okay. So for example, if I say the wrist, now the wrist is made of bones on either side, and in bridging this are the muscles, and they end up as tendons, whereas a ligament will just cross over bone. So that's the difference between those two. Okay. And so we have around all our joints, we have ligaments and we have tendons, and injuries to these we call sprains and strains. So they're the second type of injury.
Okay. So what's the difference between a strain and a sprain?
I think it's again due to the structure. Okay. A sprain occurs in a ligament, and a strain occurs in a tendon.
All right.
That's the difference. Okay. But I mean, both are nearly the same thing. So you just use two different terms. One is an injury of a ligament and the other is an injury of a tendon.
But sounds the same, but then
it's very confusing because the two names are also unfortunately very similar.
It's just one letter difference, but then it has a different meaning, of course, a thin line maybe, but then it still has. Many people refer to it as a wound. I got a wound there, a wound on the leg. I fell down while playing basketball. That's sort of a cliche line to use. If you're going to scientifically put out the words, especially say sprain and a wound, what's the difference do you see, and what is exactly a wound?
A wound is, of course, where you say the skin has got damaged. That's
Okay.
what we mean by a wound.
Yeah.
In a broad term, you can use it on various things, but a wound would be a superficial injury to the skin.
Okay.
That's where we would use the term.
And that is also a part of the acute.
Part of the acute.
All
I mean,
right.
it's like this. I mean, you can have a ligamental injury without having overlying wound,
Yeah.
because the ligament, what happens is, if you take the knee joint, we have these ligaments which prevent the bones of the knee from moving excessively. But if you put a stress which stretches that ligament beyond its stretching point, it's
Yeah.
like a rubber band. There's a certain amount of stretch a ligament can take. And so if you stretch it beyond that point, either it's going to have a small break or it's going to break off completely.
Okay.
And that can happen without you having any wound on the overlying surface.
So is it sometimes good that you actually have a wound and let the unclean blood out of your body? Because it's a common myth, or I don't know whether it's true or not, because sometimes when you're involved in an injury, a sports injury or whatever, and then you fall on the ground, and then sometimes even internal bleeding, is it fine for it to have a bruise on top of your skin, or how does that work out?
So when you fall down and you have a bruise under your skin,
Yeah.
you don't need to let the blood out.
You don't need to.
You don't need to
Why?
let the blood out. I mean, there is no purpose in doing that. The body will reabsorb it back again.
Ah, is it?
Yes.
Okay.
Unless you have a very big bruise, we call that a hematoma.
Hematoma.
Where you have a lot of blood collecting under the skin. Then, of course, you can make a decision whether to take it out, because a small amount of blood will always be reabsorbed by the body.
Okay.
But a large amount of blood may be problematic, because it will impair the healing process. And if you get a lot of blood collecting inside something, then of course we have to take it out.
All right, and we do need to consult a specialist doctor before doing anything and getting on to the next process, I guess.
Yeah, of course. If you have a big injury, you have to come and see somebody, especially if you have a big bruise, because it all depends. If you have a small bruise over your skin, that means it's a small injury and that will settle. But the bigger the bruise, the more chance that you have damaged something inside. Now,
Okay.
for example, in an ankle injury, when you twist the ankle, I mean, a small pain, it's all right. But if there's a bruise, it implies that you must have damaged something. The injury was quite severe to cause more severe damage in the underneath structures. That means either you have damaged a ligament or a tendon, or you may have even fractured a bone. This is the next type of acute injury that we see.
And I think we need to have a clear idea as to what your injury is, especially when you're out in the field playing, because it is a competitive world and you're prone for accidents, you're prone for sports disasters, if I can call it right. So thank you, doctor, for the first segment, but you're not going anywhere. You have to stay there, and you are going to stay there as well as the audience, because we are about to talk much more. So join us on Facebook as well. As we always say, it's www.facebook.com/goodmorningsrilanka, and share your thoughts on Facebook. We will be there. We'll be right back after our first commercial break on Good Morning Sri Lanka. Welcome back to Good Morning Sri Lanka. We are having Dr. Harinder Vijay Singha on the show today on Good Morning Sri Lanka. We were talking about the different types of injuries that all of us here face, especially on the fields of sports. Now, taking that aside, moving on to another area in the category of sports injuries, we hear the term heat stroke, and that's a pretty new term for me. We were talking about it, like many people, especially the marathon runners, the long distance runners, do get this sort of condition. What is it, and tell me the serious impact of it.
Our body has an optimal temperature of functioning, somewhere around 37 degrees Celsius, and once the body temperature goes up, we have several mechanisms to get rid of the heat that the body builds up when we exercise. One is we sweat, and once the sweat vaporizes, it takes heat. So we have several mechanisms. But if you exercise excessively in very warm weather for long periods, the body's ability to take off the heat goes away, and the body's temperature starts rising. And once it goes over a certain amount, maybe about 40 degrees Celsius up to 41, bodily functions start to shut down, and it causes damage to muscles. You get a lot of what we call muscle breakdown. You can get kidney damage, liver failure, all various things. And we call this a heat stroke. It's not only long distance runners, intense training courses like in the army, people get it. We've had a few players over the years, rugby players, even cricketers who have continually played in the sun, hot sun. And what happens, the initial stage, the player will start feeling tired, getting cramped up, feeling exhausted.
Dizzy.
Yes, feeling dizzy and all these things. And if he keeps on going, he'll end up with what we call a heat stroke.
Okay, so what happens when you get it?
What I mentioned earlier, you will start to get breakdown of your muscles.
Okay.
And I mean, it's a pretty serious condition because if you don't cool down the player immediately, it can lead to permanent damage.
Okay, yeah, that's what I mean. The permanence part is the most important part. People need to understand what happens afterwards. So is it curable in a very short term, or how is a curing process?
I mean, usually if somebody gets down with a heat stroke, we have to admit him. And
right at the moment,
and we keep for about 48 hours in hospital, even longer, and then we will hydrate him very well.
Okay.
And if there's a lot of damage to the organs, then we get the basic specialist involved. If there's any kidney involvement, a kidney specialist, liver specialist in.
Okay.
And then we will support this, and we will start cooling down the patient by using. There's no use using Panadol or something when you have a heat stroke. But you need to apply ice to the various areas to cool the player down.
Okay.
And it's very important, a player getting a heat stroke that is identified on field. It's too late on if you identify him. So on field,
so it should be identified on the spot.
On the field, and whoever is there should quickly identify a player and start applying ice to bring the temperature down immediately of the player and transport him to a hospital.
So how do you identify from the outside, a third party, whether this person has got it?
If somebody is exhausted, he's cramping up, he feels more tired than...
But could he be confused with something else?
No, it's very unlikely to be confused with anybody else. So you have to have a high degree of suspicion for this. And I mean, a coach or a doctor on field is trained enough to pick it up. I mean, it's not a normal tiredness that a player gets.
Okay.
He will be really exhausted.
Everything together, I guess.
Yes.
Multiplies the entire effect.
I know.
Alright, I think we do have a basic idea, but just one more question on that. Is it recommended for a person to just limit the hours of playing outside? Or what's the average number of hours?
There's no average number of hours.
But it depends from person to person, I guess.
It depends on how the person is trained up.
Okay.
For example, if
depends on the stamina levels, I guess.
Stamina levels and the training. Now, if I say if somebody who hasn't trained outdoors to run 3 hours, has run only about 15 to 20 minutes and suddenly starts doing a 3 hour or 2 hour
like
race.
Me?
Yeah, and I mean that's prone to get. So that means that person is not properly conditioned to undergo that event. So he's a huge candidate. Then of course, if somebody is doing it in a very excessively hot temperature, so you're normally used to training at a lower temperature, and you suddenly go. We had an Irish cricketer a few years back who, I think the Irish team was here, and they were playing excessively in the sun, and they were not used to it. So somebody who's not conditioned to playing at those temperatures. But the thing is, anybody can get, even a conditioned athlete can get it. And so once you start getting exhausted, cramping up, and I mean, it's basically your body saying to stop. I think you should listen to the warning, anyone.
Okay. Wow. Learned a lot on that, I guess, and I hope you did that as well. And if you missed it though, you can always catch it on YouTube, because we'll be sharing everything online, because we're cool like that. Well, anyway, moving on, this is a myth sort of question that